I recently came across this article by an OBGYN, Dr. Jonathan Weinstein, sorry if I pronounced it wrong, and I would like to discuss it. Top 10 signs your doctor is planning to perform an unnecessary cesarean section on you. Number 1, the doctor arrives to L&D immediately after office hours and says, "I just don't think this baby is going to fit." Agreed. Number 2, third trimester at a routine office visit. Quote unquote, "I think this is going to be a big baby, you should just have a C-section." ACOG has specific recommendations on when to offer cesarean section for a big baby. And just because we think it's going to be a big baby is not enough reason. Number 3, we should induce at 39 weeks, your baby is getting too big. ACOG does say that elective induction of labor at 39 weeks is acceptable, but it's elective. In the absence of any other medical indication, it is elective, meaning it doesn't have to be done, but it can be done if patient and doctor agree. Next, your baby is breech, you need to have a C-section. External cephalic version is an option for most patients. In addition, there are some providers who do vaginal breech deliveries. Another one is, you've pushed for 2 hours, we need to have a C-section. ACOG has an obstetric care consensus on the safe prevention of the primary cesarean delivery. In it, they discuss the second stage of labor, which is when you're pushing. ACOG says that the literature supports that for pregnant individuals, the longer time in the second stage of labor is associated with increased risks of morbidity and a decreasing probability of spontaneous vaginal delivery. But they go on to say that a specific absolute maximum length of time spent in the second stage of labor beyond which all individuals should undergo a cesarean has not been identified. Next, at an early prenatal visit, the doc says, your pelvis is pretty narrow. What they're doing is saying that according to their exam of your pelvis, that your bones may be too narrow, which may ultimately not lead to a vaginal delivery or a successful vaginal delivery. There used to be a time when clinical pelvimetry, which is a measurement of different areas of the pelvic bones in relation to the potential vaginal delivery of a baby, it used to be done and used to direct whether or not a patient should either try labor or just go straight to cesarean. But that's not really done anymore. It shouldn't be, because it doesn't really predict who needs a cesarean and who doesn't. And finally, congratulations, you are having twins. I will go ahead and schedule your cesarean at 38 weeks, but don't worry, if you go into labor, I will cut you right away. Vaginal delivery of twins can be done. There are certain criteria that we use to help determine how safe this vaginal delivery might be for twins and whether or not the patient's a good candidate. If you are a good candidate and you want a vaginal delivery of twins, but your provider doesn't do it, they should help you find somebody that does. What reason were you given for needing a cesarean section?